Alright, so we're going to do the Equine Fundic Exam today. So when you would use this would be when you're trying to look at the back of the eye in your equine patients. So this is a pretty commonly done thing in ophthalmic examinations, and we'll see it on clinics a lot. It just gives you a better picture of what's happening to the retina, what's happening to the optic disc, and what's happening to the vessels and stuff. So a lot of conditions can cause pathology back there, and so this is just a good way to get a good view of it. So what we use for this is your indirect lens. They come in different sizes, different diopters, and then a pen light or some source of light. So ideally this would be done in a dark condition. We'll work with what we've got, but in your exam rooms with actual horses, you'll be able to turn off the lights and get the conditions a little bit better. So the first thing you want to look for is a tapetal reflection. So what I'm looking for is just kind of a light reflecting back at me from the tapetum. And even if the horse doesn't have a tapetum, so it's atapetal, like we see in our blue-eyed horses and dogs and cats, you should see like a red light coming back at you. So what that tells me is if the tapetum is present or not, and just that I'm in the right, coming at the right angle to look at the back of the eye. So I see that. I'm going to line up my lens and my light. So I'm going to put my light right at my brow. I've got glasses, so I kind of move it a little bit so it doesn't hit my glasses. Sometimes I rest it on my glasses, whatever works for you. If you don't have glasses, it's not really an issue. And so I point that at the eye, and then I place my lens down. And I just want to make sure I'm getting a good view of the back of the eye. So that light needs to be in a straight axis from my brow to the lens and to the eye. So when I look at it, I should be seeing just the tapetum or the RPE, or both, depending on the fundus of the eye, and I'll have footage of what I'm actually seeing in this video. And so I'm going to look for the optic nerve head first, and there should be a little vasculature, which I'm seeing, so that should be normal. And then I'm going to move around, so I'm going to do So I'm going to do this so I can look at different parts of the eye while back here. So I'm going to maintain this axis, but I am going to physically move my body. And this can be one of the more difficult parts of the Fundic exam, but it's really important so you can get a good view of everything that you need to see. Because not everything's going to go by the book and just be in the center of the eye. So as we know, the indirect examination of the horse, and really in any of our animals, it's flipped and inverted. So when I see something ventrally, it's really going to be dorsal, and if I see it more temporally and ventrally, it's going to be dorsal and nasally. So with that in mind, I'm going to try and look at the top of the eye, so the more dorsal aspect. So to do that, I'm going to shift my way up, I'm going to maintain that axis, and look down. Typically in our normal horses or our live horses, we'll be able to move their heads around to help us shorties with that. That's better. And then to look at the bottom of the eye, I'm just going to follow it down. All right. So now I'm going to try and look temporally. So I'm going to follow the light, and again, I like to move my entire body and step. Sometimes people just like to lean. And that can be just depending on the person. I like to move though. So I'm going to look more nasally side there. All right, perfect. All right, everything looks great. I'm gonna adjust my lens. Awesome, so remember to maintain that axis and just do your best. It's a little bit of a difficult skill, but it's really important. Thanks.